In this video, you're going to be learning about the top 5 questions I get in the examination room when I'm examining patients' eyes as an optometrist or an eye doctor. So be sure to stick around for the number 1 top question towards the end of this video, but I'm going to start with the number 5 and work our way up to the number 1. Number 5 on the list is, how's my eye pressure? When we measure eye pressure in the exam, whether it's in the pre-checking process or if I need to do it for managing glaucoma for a patient, for example, which is damage to the optic nerve, sometimes I like to measure eye pressure in certain ways. And there are honestly dozens of ways you can measure eye pressure when it comes to checking the global eye pressure of the eyeball. And a lot of times I'll inform patients that your numbers look great, they're not so great, they're a little low, they're a little high, they're somewhere in the middle. And usually I'll describe what the number means depending on what numbers present and what methods were used and what I'm typically looking for in order to make sure that eye pressures are healthy. Did you know that in the human population, the average eye pressure in the human eyeball is about 15.5? And we don't usually measure in 0.5s, but according to many studies, that's just a number that's used a lot of times in order to validate what average human IOP, intraocular pressure, is. So eye pressure is number 5. Number 4 is, what are these little things floating around in my vision? What are these globs? What are these black dots? Why do I see a rat's tail? Why do I see a cartoon squiggle? Why do I see clear little jelly strings in my vision? Why do I see floaters? What are they? So a lot of times I'll go into explanation about what floaters are, what causes them, why they're there, why the patients are seeing them. And I'll usually examine some different areas of the retina, like in the periphery, to make sure that there's no retinal holes, tears, detachments, anything that could cause an issue with the sight or vision. And I've made a previous video about what floaters are and how they can come about. So if you want to check that out in this description, that's going to be, or this little link that's going to pop up in the video in just a few moments, that's what that's going to be about, if you'd like to learn more about floaters. But it's this jelly in the eyeball that as you get older, kind of becomes more water-like, and sometimes the jelly fibers clump together for the most part. So floaters are number 4. Number 3, do I have cataracts, or what are my cataracts at? Is it going to mean that I have to have cataract surgery? And that depends on the examination a lot of times, depending on what I find, depending on what is discovered in the exam, what's affecting the patient's vision. And probably the number 1 most common symptom among patients that are experiencing some level of cataract development or cataract progression is difficulty of driving in low levels of light, such as when they're going home from work or going home from somewhere and the sun's going down, or if it's nighttime driving, just because that pupil opens up more, hits more of that cataract and scatters the light in multiple directions. Sometimes some people need more illumination in order to be able to see things, read things, books, stitch, crochet, crossword, anything like that up close. It also affects distance vision. It affects near vision. And with the exam, we can determine, or at least eye doctors can determine, what level of progression the cataracts are at. So that's number 3. Number 2, why is my vision blurry? This is the second most common question that I get in the exams that I conduct, is that why do I experience blurry vision? What's making me see difficult, or why can't I see far away? Why can't I read up close? Why can't I see my computer screen? Why can't I see the food that I'm cutting up when I'm preparing a meal? Why can't I see menus at the restaurant when I go out to eat? Why can't I see certain things in certain scenarios? Why does it give me a headache? Why does it make me nauseous? Why does it cause me to feel like my eyes are just tired all the time? There's a whole host of reasons of why the eyes can be blurry. And again, this can range from prescription error, dry eyes, cataracts, whole bunch of different stuff that can happen with what's diagnosed in the exam in order to determine what's making someone's vision significantly blurry, or even just a little blurry for that matter. Sometimes it's birthdays. Sometimes it's doing a lot of computer work. Sometimes it's a lot of extended reading that someone's not used to, or a new career job change that's requiring someone to read as much or not read as much anymore. And the top number 1 question I get in most of the exams that I conduct, whether it's glasses, contact lenses, medical evaluation, is, did my prescription change? What is my new prescription? Whether it's glasses, contact lenses, or if we need to change the type of prescription drops we have the patient on for a variety of reasons. A lot of times there are many changes that occur when it comes to someone's prescription, whether it's a little bit or a lot of changes. It just kind of depends on, are there health issues at play? Are there eye conditions at play? Are there external environmental factors at play that are factoring into this? Is this an age-related eye vision change? Is this simply a dry eye thing? Is this simply something else that was discovered in the exam that hasn't been discovered before, or that's been discovered but it needs to be addressed now? So whether the glasses changed a little bit or a lot, whether the contact lenses changed a little bit or a lot, or if we need to change the type of concentration or type of prescription eye drop that the patient needs in order to be able to see better, not have red eyes, or just feel better for that matter, or if we're managing glaucoma or different things like that. But if there's certain topics or certain things you'd like to see covered on this channel, drop it in the comments below and I'll get to it and be able to cover it in order that we can get more information and education and knowledge out there, and that you can share it with your family, you can share it with your friends, you can share it with your colleagues. And I don't have all the answers and all the knowledge and all the education, but I have learned a lot from people much smarter than me, and I like to be able to share this knowledge with y'all so that you can share it with other people, and then it may benefit, bless, and add value to their lives as well too. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for notifications and to learn more about your eyes. And again, if there are any other topics or things you'd like to see covered on this channel, drop it in the comments below. I'm Dr. Bryce Heffington. We'll see you next time.